Hi everyone, my name is Emma and I am here with my group to talk about our health promotion program implementation. So we chose to do French Hospital Medical Center in San Luis Obispo for our Worksite health promotion program. It is a well-established acute care hospital that employs approximately 500 staff members across many different roles in the hospital, including nurses, doctors, custodial staff, support staff, you name it. The hospital runs 24/7, so employees often work long and really demanding shifts with varying schedules, which can make maintaining healthy routines really hard. So, in terms of background context, French Hospital does not currently have like a formal, structured wellness or nutrition program in place. There are occasional health-related initiatives and like information available, but there's no consistent program that specifically targets towards improving employee nutrition or eating healthy during the work hours. Through understanding the hospital environment, several workplace challenges became clear to us. Many employees experienced fatigue, high stress, limited break times, and inconsistent access to nutritious meals. So, especially during early morning, overnight, and back-to-back shifts, staff have little time to prepare food before or when they leave, or even at the hospital. They just need to be able to grab quick things to help them cope during their long and hard hours. So these factors highlight a clear need for practical, accessible, and a nutrition-focused program to help them. This context is what informed the direction for our project, just because, again, it centers on implementing a ready-to-eat breakfast initiative designed specifically to support daily health and well-being for French hospital employees.
Based off our needs assessment, we found it necessary that workers in the hospital have access to nutritious meals. With a busy schedule and long hours, having meals that are prepared can aid in workers feeling less stressed in the workplace, and this can lead to improvements overall in their cardiometabolic health, is what we found in literature reviews, and then also in their diet, improvement in their diet overall. Implementing these meals 2 days a week for these healthcare workers can drastically improve the health overall of the healthcare staff. It is important that these meals are reviewed by nutritionists in order to ensure that they are and have nutritional value for them. And it is also very important that these meals are culturally tailored for all of the healthcare staff and workers in the hospital. The outreach material that will be provided to the healthcare workers will be in plain language, and they will also be easy to understand and in places that the healthcare professionals can see and will be able to understand. And they will be in places such as bathrooms and lunchrooms. And it is also important to note that this program will be free of cost for them.
Our project focuses on enhancing the health and well-being of employees at the French Hospital Center, specifically targeting nutritional health through the development of a breakfast program. We structured our initiative around SMART goals. First, the program is specific in its aim to provide ready-to-eat, nutritious breakfast options for all hospital employees. It's measurable, meaning we aim for at least 75% of staff participation within the first 3 months, as well as a 20% increase in self-reported usage. Our plan is achievable because we will partner with a licensed accredited meal vendor to ensure consistent access to high quality meals. It's relevant because staff identified stress, fatigue, and poor nutrition as major concerns in our needs assessment. And finally, the program is time-bound with a planned launch within 6 months and surveys at the 3 month and the 6 month marks to evaluate participation, satisfaction, and perceived health impacts. Overall, this project highlights how our team is aligning this project with public health initiatives while supporting a healthier workplace environment for hospital staff at
When designing a health promotion program, there are definitely some program components that are necessary to be taken into consideration. Obviously, we have our goal, which is to enhance employee health and well-being through accessible, nutritious breakfast options. Within this goal, there are some strategies and lead and support roles. When it comes to main strategies, we have environmental reconstructing, nutrition education and awareness, social engagement, and incentives. When it comes to environmental reconstructing, we have providing ready to eat prepackaged breakfasts twice per week. And these meals will usually come from licensed vendors. These will be stored in staff refrigerators. Nutrition education and awareness, they can use QR codes that are going to be offered on these quick nutritious breakfasts that'll get a quick digital message referring to what is inside and how they can maybe even make this at home. Social engagement and incentives includes hosting maybe a breakfast challenge among the employees or offering recognitions and small wellness awards such as coffee vouchers for maybe the employees who take the most advantage of the resources. For leads and support, we have program coordinator, registered dietitian, vendor, stocking assistant, and the marketing team. Our program coordinator will oversee logistics such as vendor communication and even our budget. Registered dietitian will just review menus and create educational content and just look over any allergen needs that are specific to certain employees. Our vendor will prepare and deliver these high quality meals to the hospital as well. Stocking assistant will simply just stock any of the storage and just continually rotate any food that is brought in or not eaten. And finally, with the marketing team, our marketing team will design and distribute flyers, posters, and staff emails that will go out. This might be regarding what meals will be offered that week, or maybe any specials or any incentives that might be occurring. So for our implementation plan, we decided to follow the CDC workplace health model, and this includes 4 phases, which are assessment, planning, implementation, and evaluation, and I will be touching on the first 3. So for assessment, this includes a needs assessment, review, survey data, and hospital goals, as well as budget. And usually who is responsible for this is the program coordinator with maybe the dietitian as well. And this is usually taking place in month 1. For step 2, which is planning, this is when we would love to find vendors, collaborate with our dietitian, order any equipment that might be needed, communicate, and also provide mid-program surveys. This will be also heavily led by our program coordinator, our dietitian, faculty, and marketing. And this will take place at about month 2 to 3. And finally, for implementation, this is when we will launch our program and promote, as well as engage and advertise. This is run by our program coordinator as well, our dietitian, vendor, and very heavily marketing. And this will take place about month 4 to 5 before we have our evaluation, which is step 4. For ongoing engagement during this time, this is when we promote the program via flyers, supervisor announcements, or weekly emails. We would also love to offer culturally diverse meal options and inclusive messaging, as well as gather informal staff feedback to maintain participation and satisfaction. This might just be through word of mouth, or even just like a little suggestion box that's left in the break room that says, hey, maybe I didn't like that, or hey, maybe I really like this.
For our program evaluation, we'll be looking at both process and outcome measures to make sure the breakfast program is implemented effectively and actually improves staff wellness. First, for process evaluation, we want to understand how well the program runs. We'll track weekly participation rates using sign-in logs or QR code scans to see how many employees are using the program. We'll also check that the meals are consistently available and meet nutritional standards. A short mid-program survey will collect staff feedback about satisfaction and accessibility, and the program coordinator will document any issues with vendors, stocking, or communication. For outcome evaluation, we'll measure the impact of the breakfast program on employee behavior and well-being. We'll use pre- and post surveys at the start, 3 months, and 6 months to compare changes in breakfast eating habits, nutritional knowledge, and self-reported energy, focus, and fatigue levels. We'll also look for behavioral shifts like reduced reliance on vending machine snacks or tending to skip breakfast. Finally, we'll collect qualitative feedback through short focus groups or open-ended survey questions to understand the overall employee experience. And some of the evaluation tools that we'll be using will be digital surveys, participation logs, and QR codes to collect data, staff feedback forms, and coordinator and vendor reports. Together, these processes, outcome measures, and evaluation tools will help us determine not only whether the program was implemented successfully, but also whether it made a meaningful difference in the health and daily routines of French hospital staff.